Okay, everyone, Assalamu alaikum and welcome to today's webinar on preparing for safe reopening of London mosques. Mashallah, we're really blessed to have a lot of different mosques with us today, providing inshallah some insight on their proposed way forward, as well as the opportunity for you to ask some questions or share any of your comments and feedback. Just some housekeeping today, so obviously would ask everybody to be on mute unless you're speaking. Please do post your comments on the chat box or your questions as well, and we'll get to them after every speaker, inshallah, or at the end. This session is being recorded, so be aware of that. It will be circulated afterwards. And inshallah, we hope to have a really productive and good hour to make sure everybody gets their feedbacks and points across. Okay, I'm just going to ask firstly for a short introduction from Hassan Judy, the Deputy Secretary General of the Muslim Council of Britain. I'll pass it over to you now, Hassan.
Thank you very much, Sister Zara. We'll just begin with some short recitation from the Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والتين والزيتون وطور سينين وهذا البلد الأمين لقد خلقنا الإنسان في أحسن تقويم ثم رددناه أسفل سافلين إلا الذين آمنوا وعملوا الصالحات فلهم أجر غير ممنون فما يكذبك بعد بالدين أليس الله بأحكم الحاكمين. Surah 13, chapter number 95. In the name of Allah, the All-Merciful, the Ever-Merciful. I swear by the fig and the olive, and Mount Sinai, and the city made secure. Certainly, we created man in the best make. Then we render him the lowest of the low, except those who believe and do good. So they shall have a reward never to be cut off. Then who can give you the lie after this about the judgment? Is not Allah the best of the judges? Sadaqallahu al-Aliyyul Azim. So welcome one and all, as Zara mentioned, to this morning's session. I know many of you have joined us in previous sessions as well last week, and a lot of things have changed in the last 7 days. So I'll just be going through a very brief 10 minutes quick summary of really the latest updates from that regard, and then very quickly handing over to our panelists from today who'll be sharing what they have been doing in their London centres in terms of preparing for reopening, and also some of the other support and measures that they think the community is going to require, both in London and beyond, to help our communities in the next couple of weeks, inshallah. Of course, we know that many people here joining us from outside of London as well, and you're all more than welcome. And this is really about sharing best practice and sharing updates so that we can all help each other move in the right direction. I'm Hassan. I'm part of the leadership team at the Muslim Council of Britain as well. My day job, I work as an engineer in the energy sector, and my capacity in MCB is as Mosque Affairs Coordinator. And I think all of us who are involved in the coordinating of the affairs of masjids, whether it be our own, be it our local council of mosque, local region, local borough level, or more wider, I think have our work cut out in the next couple of days and weeks. Just on my screen, of course, the biggest thing that has happened in the last 7 days is this issue about individual versus congregational worship. So I'll just be touching on that for a second. But before that, just to kind of almost summarize, and for those of you who have joined us in previous sessions, you'll be aware the MCB, we started to consult on this issue back in early May, in the middle of Ramadan, to seek and to understand views about what is reopening safely going to look like. Last week, the week before last, we had a series of webinars across the country, North Midlands and South, and also with the national associations last Sunday, and today we wanted to make sure that the London mosques, who a lot of smaller messages we have to remember look up to, and are waiting to see what they do to take their lead, and look up to them for leadership as well, will also be doing as well, inshallah. Earlier this week, the MCB published this document that you can hopefully see on your screens, which is the 9 steps to reopening mosques safely. It's a 22-page guide, and it really captures or summarizes what we have heard, what we have listened to, what we have absorbed by listening to Muslim communities since the beginning of May on this topic. I'm not going to go through it in full depth. Those of you who've seen it already, great. If not, if I could ask if Zara or someone else can just post in the chat box, that would be really useful. I forgot to mention also as well, but obviously we're going to be, please, we're taking questions throughout. So please post your questions or comments in the chat throughout, and then we will have Q&A in the middle and towards the end, inshallah, to address your questions. So this guide really kind of tries to summarize all that. So I'm not going to go through it in full depth, but I'll just pick up and highlight on a few key areas and leave the rest for discussion, inshallah, and for you to look at the guide in your own time. The 9 steps that we're recommending is this: plan when and how, decide when and how to open, plan the space and the equipment that you're going to require, how you're going to train your staff and volunteers, and then preparing or educating the community. One of the things that we've said in the previous webinars last week is that perhaps that step number 5 is arguably one of the most key in all of this. You know, perhaps as much effort that we should be putting into preparing the building, as much effort perhaps needs to be going into preparing the community and educating the community before they come into the building for the first time, again, post-lockdown, in terms of what they're expecting, inshallah. And then plan pre-prayer, prayer, and post-prayer, some details around that. And then lastly, of course, plan for problems, what to do if things don't go to plan. I'd like to just pause here for a second to touch on individual worship versus congregational worship. So as some of you will know, last Sunday the government announced that they were happy for only in England places of worship to reopen for individual worship, which is defined as individuals going in to pray, but not as part of a group or communal led prayer. So what that means for mosques is they can go in and they can pray on their own, by themselves. They can sit by themselves and read Quran, but they cannot pray any of the Jama'ah daily prayers, and certainly not Friday prayers, and any classes, Quran circles, study circles, all not allowed. The government, the UK government then put out some detailed guidance on this on the 12th of June, that's 2 days ago. And this is a mini summary that the MCB has put together for that. It's available on our website. And again, if the link could be shared, that would be much appreciated. I'll just go through it very briefly as a reminder. Congregational worship has not changed. The government has still said that that's only from the 4th of July, subject to further scientific advice, is the sentence that they're using. Of course, this is only for England. For Wales and Scotland, they have different timelines that haven't been announced yet. So at the moment, as it stands from today, the only uses that a mosque is permitted to be open for is essential maintenance and cleaning, broadcasting or recording acts of worship that you can broadcast over the internet, radio, or TV, essential voluntary services such as food banks, such other support mechanisms. Many people may not be aware, but also very small funerals for members of the deceased household or their close family members are currently allowed. There's no maximum number on it. The guidance just says as few people as possible, but those are allowed in places of worship, including masjids, as long as people keep their 2-meter distance rules. And then individual worship, which I'll come on to in a second. All the things which are currently not allowed, but of course things may change on the 4th of July, but currently not allowed: group or communal-led prayer, such as the 5 daily prayers and Jum'ah, other ceremonies such as or events or classes, Quran circles, study circles, weddings, and yeah, madrasas and other classes should remain online. A few other things that the government's guidance on that came out on Friday had or didn't have, just to bring to everyone's attention in case you haven't already seen. So the government is not saying face coverings or masks is mandatory in mosques. They haven't said that. However, as we know, from tomorrow, the 15th of June, anyone going on public transport, face coverings are compulsory. That said, and as we know, many people are wearing face masks in general, not only from public transport. The World Health Organization is recommending it. From our own community, the Buddhist Islamic Medical Association, BIMA, who will also be speaking slightly later today as well. They're also recommending it because there is good evidence that it does reduce the risk. So it's not mandatory in mosques or places of worship, but from BIMA, it is recommended for mosques. Young people and children, the government has not put a minimum age on who is or isn't allowed in places of worship. It's up to us to determine or interpret what is best for that. And at the moment, of course, if you have very young children, if they're not able to social distance, if they're going to be running around, etc., then we're recommending at the moment that they're discouraged, at least initially, from attending masjid. Again, on the other end of the spectrum, the elderly and the vulnerable, over 70 or those who are defined with certain illnesses in that government document are strongly advised to stay at home. Anyone showing symptoms, definitely stay at home, and they should be continuing to pray at home. There's been no new information about the test and trace. Again, unlike other countries in the world where the places of worship have had a fixed upper limit on the number of attendees, the UK government has not stipulated that, and so it's up to each mosque to determine what their new maximum capacity is based on the current 2-meter social distancing rules. Of course, we know that there's some talk in the press now about that being changed, and no one can really comment on that until there's more information about that, but that there is a possibility that that might change. And now individual worship. So again, we know from yesterday and today, some masjids across the country are trying this, and they are reopening for individual worship. From speaking and listening to many masjids across the country last week and this week, the vast majority are saying that it's quite impractical and challenging for them to make their building and to educate their community to use the building in this individual worship way. And so what we're currently recommending is that, yes, it might be legal to, but given the limited time and effort that our volunteers and staff have at our masjids, it's perhaps wiser or more useful use of our time to prepare for when congregational worship will be possible from the 4th of July at the earliest, with timeframes for Scotland and Wales still to be announced. The full government guidance is on their website, which was published on Friday, and the MCB's guide published earlier in the week contains a lot more detail, of course, specific to masjids to cover these. I'm not going to go through in full depth, but I just wanted to highlight 2 or 3 things that have come up in discussion with people who I've been speaking to and others since this was published on Wednesday. Number 1, Quran. The bookshelves of Quran. We are hearing and seeing a lot of people perhaps not taking that as seriously in terms of the risk of transmission from that. Under step 2, plan the space, we have suggested to close non-essential spaces to members of the public, of course not for staff or volunteers, but kitchens, other rooms, etc., which are not essential and which are difficult for control, to close them. But also in the main prayer hall, you may have Qur'ans, you may have other books, etc. These are sources of or risks to transmission. If one person touches it, then and someone else comes within 2 or 3 days and touches it again. So ideally, please remove them and put them in a temporary storage somewhere else afterwards. If that's extremely difficult or not practical for you, then the next best thing, some kind of covering, some kind of cloth or something. But by and large, the best option if you can is to remove them. Of course, in addition to that, what we've also recommended as part of the educating the community side of things, which is step 5, is to educate your community who will be coming to use the building again to bring their own Quran from home, and of course to take it with them when they leave, or better yet, if they have their own mobile phone or tablet, to use a Quran app to read or recite the Quran, and similarly with other items such as a tasbih, the prayer beads or the rosemary beads, as well as their own prayer mats as well. So that's 1. Number 2, fire doors. So again, we are seeing risk assessment is a big part of course, what we need to be doing at this moment in time, and it's going to be very unique and custom to each masjid. And part of the recommendations is to have a one-way system where possible for your entrance and for your exit to minimize the risk of people congregating, and where of course then they'll not be able to maintain 2-meter social distancing. A reminder really that fire doors does not count as part of that, so we should not be using fire exits to increase the number of entrances or exits. And also internally, if you have doors, if you wanted to consider keeping doors open with a doorstop or something else to minimize the risk of people touching the door handles, etc. Again, yes, that's fine, that's suitable, but please make sure that those are not fire doors or fire-rated doors. Those building regulations state that those need to be maintained shut, because in the event of a fire, it helps in the minimizing the spread or the risk of fire in the building. And again, with this specifically, we highly recommend to touch base and speak to your insurance company, your insurers, and ideally get something in them from writing as well. If you have a draft risk assessment, share it with them and say, here's what we're currently thinking. Please, can you give us feedback, for example, or ask them if there are any considerations that they are expecting of places of worship, such as yours, that they are insuring. So as important, really, really important to engage with your insurers on this, and please make sure that you do not use fire doors as additional exits, because that's not what they're meant to be used for. And finally, cleaning. There has been some, what is cleaning? And the government's guidance on the 12th of June, 2 days ago, didn't specify in a great level of detail exactly what good cleaning looks like. It did signpost to a separate webpage on the NHS website that has a bit more information about cleaning. Again, it's down to each masjid to interpret that how you feel is best. But as far as possible, and also for your own documentation's sake and for your own peace of mind, and also to share with your congregation who are going to be coming to use the building, or be in limited numbers again, for their peace of mind, make sure that you have a fully fledged and thought through cleaning schedule as well. So I'm going to pause it there in terms of brief context, and in terms of just highlighting some of the key items in this guide. But again, I do encourage you, make sure you have a look at it in your own time if you haven't already. Any questions or queries or comments about it, feel free to share as well. And the final thing to say is that, as well as the guide itself, there are a number of appendices in the guide with templates, a template communication plan, some posters about what does 2 meters actually look like in a masjid in terms of the prayer hall, screening at the mosque entrance as well for your volunteer or staff member who's going to be screening attendees as they come in. This one's for the community. Should I pray in the mosque? So we need to also be educating our community themselves to make that decision about whether they are high risk and should be praying at home, or whether it's okay for them to be praying in the mosque. And also a plan for what happens if an attendee develops COVID symptoms. All of these can be downloaded on the MCB website as individual files, as well as other useful templates and checklists as well. I'll hand back to, hope that's useful as a summary, and I'll hand back to Zara now to go through our speakers for today, inshallah. Jazakallah for your time.
Yeah. Thank you so much, Hassan. And as you can all see, mashallah, really thorough and comprehensive booklet, but also lots of pictures, so it's quite easy to manage. Some really great comments coming in. Thank you so much. I'm going to ask some of our speakers to address some of those points. I think really around safety and shoe racks and all those things. So I'm just going to bring our first mosque, inshallah. If I could ask a representative of Al Manar now to be speaking, inshallah.
Assalamu alaikum.
Alaikum assalam. Oh, how are you, Abdurrahman? You okay?
Alhamdulillah, I'm fine. How are you guys?
Good to see you, mashallah.
Good to see you too. Jazakumullah khair. Thank you for organizing and making the time for this one. Can I share some document here?
Yeah, inshallah. Yeah.
Okay.
Hassan, I think you're going to have to make Abdurrahman.
You authorize me, yes, that's right.
You have to give him the power.
That's right.
Give him co-host abilities, yeah.
Yes, right. Just quickly, I know I have only about 5 to 7 minutes time. What it is, we're part of a mosque counseling coordination or coordination council, which involves around 10 mosques in London. So there has been a joint statement by the council now, stating that we will continue to stay closed for at least until we are assured that it is safe to open or reopen the mosque for congregational prayers. We are not very comfortable with the idea of private worshiping because simply the very principle or essence of a mosque is really to provide for a congregational prayer, Salat al-Jama'ah. So that is the most important, and we need to make sure that is also the service that the mosque can be reopened for. The second issue, we did have a plan B in case if we have to go along that line. Then what do we need to do? How can we organize this? And I'm glad to hear Brother Hassan speaking that they cannot use the fire exit doors as a second door. In fact, that's literally what we thought of doing at Al-Manar. If we were to go ahead with this private worship, then we would have to use one of the fire exits anyway. So that is good to know that it's not the best option to use. There are obviously issues of cultural awareness also of the need to sanitize and use the social distance measures and so on. But luckily for now, we're not going to go through that, at least on the 15th of June, tomorrow. But we will be reviewing again alongside the 10 mosques towards the end of this month, whether it's still safe to do some kind of like measured reopening in early July, around the 4th of July. If not, then we'll again issue another statement to clarify our position. So we're very much dependent on 3 sources of advice and guidance on this issue. First, of course, the government advice and guidance, the public health authorities, including the local ones we are in touch with, we're taking advice from them as well. And the third and equally important is our own mosque sector, which include also our imams and also giving the religious advice and guidance on this issue, what is permissible and what is not, and so on. So those 3 sources of guidance will be influencing the decisions that we make. In the meantime, we're keeping our doors open. We've been serving the community throughout the COVID-19 lockdown, and that included offering telephone line therapy or therapeutic counseling. That is still available and it's running. The second one was and has been the provision of food packages to people affected by the lockdown, especially those who are considered, in quotation marks, clinically vulnerable. So they could be elderly people without any recourse to any support, or even less elderly people, but with still issues of infection and other problems. And the advice and guidance through also virtual lines or means is continuing. So in reality, the closure has only or mainly affected any kind of congregation, whether it's for worshiping or the kind of madrasas and Saturday schools that we had. Those are the ones that have been affected. But with the madrasas and the Saturday schools, because we're now also approaching the end of the summer term, it would have been closed anyway for the summer holidays. But we're also using that to rationalize and see if we can use the new technology to reach out to our children and continue the services. So hopefully, inshallah, COVID-19 and post-COVID-19, we would have adapted to some new cultures of working and delivering our services, inshallah. With that, I think I should end, and we'll be happy to answer any questions.
Yeah, thank you so much. I think that's a really helpful overview. And in the interest, if there are any questions, please do put them in the chat box. But I think in the interest of time, we'll maybe move on to the next masjid. If I could ask you to stop screen sharing, inshallah.
Sure, please.
And inshallah, next we're going to have London Central Mosque, representative from London Central Mosque to speak.
Hello, assalamu alaikum.
Walaikum salam.
Hi, my name is Ayaz. I'm representing Dr. Ahmed Al-Dubian today, as he's unable to make the meeting. I've worked in the past for 10 years as head of public relations and communications at the centre. Just really reiterating the words of Brother Abdul Rahman from Al-Manar, the difficult times, and it's the 9-page guidance is very useful. The main things I can think of which are what our mosque is looking at doing is obviously going with the 10 Mosques Council from London in terms of the latest press release, which was just sent out a couple of days ago. Obviously, we don't advise opening in the near future, and we're just looking at the logistics of how to manage re-entry of people and the difficult decision of deciding when the mosque is full and who to stop from coming inside once it is at maximum capacity. And also the issue really of where the majority of the people who come for prayer are more from a slightly older age group, and like you said, is educating and making them understand the vulnerabilities they may have. That maybe it's better they don't come. We kind of see that as a bit of a worry at the moment. The centre itself obviously has been closed for a while now. We have been working, giving advice and guidance virtually over the phone as well and online, and we have started a food bank during Ramadan, which we are continuing. And we've since the middle of Ramadan, we've probably provided dinner meals for up to 5 years worth of hot meals to vulnerable people, and that's being delivered to their houses. And we actually partnered with a food bank who provide halal food from Shazan, chicken and what have you, and they're purchasing and we're labeling up with the London Central Mosque labels that people trust that the work itself, the food itself is halal. So we're doing those kind of same services, but the main thing we're also looking at is obviously this second wave with this pandemic, and obviously with a lot of protests going on in central London. We're a bit wary that this timing of opening the centres may coincide with slightly increase in the people being analysed with this virus. So we're just a bit worried that we're hesitant that we should be opening at this time as well. And as Brother Abdul Rahman saying, we'll wait to the end of the month where there'll be another meeting, and we'll take it from there, inshallah.
Yeah, thank you so much. I think some really good critical points, definitely, on opening up. And I think something that everybody's really worried about is how do you decide who gets to come in and who is stopped, and how do you manage that process? I'm just going to pass it over to, thank you so much, brother, the Muslim Welfare House, a spokesperson from the Muslim Welfare House, and then if we can get East London Mosque, and then we'll do a short Q&A with some of the different questions that have been put. If I could also ask you to look at some of the chat. Are you Brother Mohammed Ijaz, are you the spokesperson? Or?
Please, I would like to say a few words. Right.
Are you Muslim Welfare House?
No, I am from South London Islamic Centre. I'm the chair of...
Okay. We're just going to take Muslim Welfare House, and then we'll come back to you if that's okay, during the Q&A session.
Yes.
Okay. No, thank you so much. Yeah. Is there someone here from the Muslim Welfare House? I don't believe anybody's here yet. So if I could ask Mohammed
Finsbury Park.
Finsbury Park?
Yeah, Brother Kosbar is there.
Oh, he's going to be on the second half, don't worry.
Okay.
Okay. If I could ask East London Mosque then, Brother Mohammed Habib Rahman, if you could say a few words.
I think he needs to mute himself.
Yeah, it's... Okay.
Yeah.
All right. Assalamu alaikum wa rahmatullahi, everyone.
Walaikum assalam. Thank you.
So, Jazakumullah khair MCB for organizing this webinar. I think it's really important that communication between the masajids are kind of ongoing as the guideline unfolds. I think very many good information has come out of the MCB, which really is very helpful for the community, alhamdulillah. From the East London Mosque, we have been discussing this on a regular basis with our trustees, but also coordinating with the local masajids as well. I know there is a strong feeling from the community that they want to come back to the mosque as soon as possible, but we really do need to bear in mind that our community has disproportionately suffered from COVID-19, and the risk is a lot greater, and we need to do everything that we can to safeguard the community. So therefore, it's really important that we don't have out of sync activities going on out of emotion and so on. So with that, in that regard, I think what Abdurrahman and what Abdurrahman outlined, I think most of us are kind of thinking in a very kind of similar way. There is obviously a great need for the risk assessment, and I think we've just written, I think, from the East London Mosque and put out a statement saying that the guidance from the government about the individual worship isn't really very helpful for the mosques. And I posted a question to see if anybody's actually responded to any of that. I hope nobody has, because I think that's really not, as Abdurrahman mentioned, that this is not the spirit of the masajids. And individual prayers can be done at home. What we really need is congregational prayer and how we can best do that. And we really do need to prepare for that and make sure that we don't kind of jump in too early without proper preparation. And I think the initial talk from Brother Jody was really very helpful on the guidelines as to the kind of preparations, and we shouldn't really overlook all of those preparations. It's really important that we are very thorough in our preparation for that. I do also believe that there is probably a need for a very gradual return to the masjid. And again, this should be part of our risk assessment. And the most vulnerable in our community, and this is something we found quite difficult, because when we had the lockdown also, even before we closed the mosque, we did encourage our most vulnerable members of the community not to come to the masjid, and that the scholars and the imams were saying that this is for them, it's perfectly legitimate for them to pray, and in this circumstance. But even then, we found it was very difficult to restrain our elderly in particular, and that they were really coming. So I think the issue of how we manage as and when we do open, of restricting numbers is going to be a real issue, and how we can actually manage that. I have seen one or two mosques putting out tickets and things like that. Again, I think that really needs to be thought through, because what we don't want to do is open up something that isn't practicable, and it's really not helpful for the community. But the gradual return does probably need to be planned. And I think the scholars do say that the most important, what we can't do really at home is the Jum'ah prayer. And perhaps we need to think about how we actually return in a kind of safe, limited way with the Jum'ah prayer before returning with the five daily prayers. I think the point was made, which is really important, about preparing the community. And I think managing and managing the expectation of the community is really very, very important. Alhamdulillah, I think most masajids have actually continued to provide services online and through recorded messages and so on to the community. And alhamdulillah, we've done quite a bit of that, and we are maintaining that. So it's really important that communication is clear. Communication goes out to the community, what the guidance is, what we are allowed to do, what we can do, what is safe for us to do. And again, I think it really needs to be very, very locally managed, that each institution, each masajid is different. There are different sizes and different facilities which are available, and different kind of capabilities in terms of resourcing and so on and so forth. So I think it's important that according to our own circumstance, according to our own kind of resources, that we do the risk management and plan accordingly how best we can actually do that, but manage the expectation of the community through very clear communication with the community. So I think like I've mentioned that, we have continued to provide services. There are, the vital services and the ongoing communication, particularly with the imams, and also putting out regular, maybe recorded messages from our scholars and our imams is really very important. We've tried to do that. And I think at this time, I think we need to be timely as well. So what we don't need to be doing is really reacting to something. And we, as I mentioned, that the coordination is very, very important. And it would really help if we are able to synchronize, coordinate, and make sure that we kind of act responsibly and together, inshallah. I do understand the differences maybe up and down the country and so on. So it doesn't have to be everything all at the same time and so on. But it does need to be through kind of common understanding of the risk, and understanding of the guidance, both from the from the medical profession, but also from the health professions as well. So inshallah, with those few words, I will stop here, inshallah. And if there's other things that come up, then we can. But the Dua is also here, inshallah. He might be able to put in some of the practical things that we're doing, inshallah.
Yeah, just a couple of points that have come up on the chat, if you'd like to respond. And there's a lot of questions on risk assessments, particularly whether small mosques need to do them, how they should do them, and what kind of support there are to do them. So is there any advice that you have?
Well, locally, I think we are coordinating with our Council of Mosques in Tower Hamlets. We have over 40 local smaller mosques and so on. We are in the process of doing the risk assessments ourselves. We do believe that we have the capacity to do so, and we will be supporting our local mosques locally. And I think I'm not sure whether we actually need consultants to come in and do that. Where people feel they need the support, I think in the first instance that masajid in the locality should try to help one another. If they have the capacity, we'll be doing that locally for our masajid in our locality. And then beyond that, I suppose we can discuss what more we can do. But I'm not aware that we need to actually hire in consultants in order to be able to do so.
Yeah, thank you. And Brother Abdurrahman, there's been quite a few questions around obviously managing individual prayer, but also moving towards congregational prayer. What do you think is really important for mosques to be mindful in making sure they carry out individual prayer to the best of their ability before thinking of opening things up again, in that gradual step?
I think the advice now is to focus on the congregational prayer, because that's the most important. And as a brother from East London Mosque was saying, the Jum'ah is a very crucial one. And then when it comes to managing the congregation, it's going to be safe for everyone, and it does not lead to any kind of infections of any sort. So until we get to that point, I think the private worship issue, it's really like a bombshell. It has just arrived with the announcement by some of the ministers. But I do hope they will review that decision as well. For us, I think the resource we have at present, at Al-Manar at least, we are not able to really manage that on its own. If every individual has to come and do the private worshiping, it requires not only the risk assessment and the measures that you can put in place, but it also requires manpower who should be there to manage and guide people. And with the current level of financial resources, it's beyond our means. We have actually put most of our stuff on the furlough scheme. So it's completely beyond our resources right now. That's all I can say.
No, that's great. And just a final question to London Central Mosque, just regarding how important is it for committees to sit down and go through all of this information and have a plan ready? I mean, how much time do they need to spend to do this?
In relation to the reopening?
Yeah, in relation to reopening safely.
Well, obviously it's paramount, the fact that we need to all sit down as committee members or as the management committees and to reorganize. Like I said, the paramount thing is safety, and like what Abdurrahman was saying, London Central Mosque is lucky; it has the big courtyard, so people can pray outside, and it does have entry and exit on opposite sides of the mosque. But the key isn't that we open quickly. The key is that we open safely, but as well as that, it's very important that we all open together. So the mosques should be united in terms of when they open and close, so we don't confuse the communities, and we all kind of move forward with one word together. So, I mean, coming back to organisation, I think your documentation is good. I've seen one or two others as well, and I think the mosques just need to come to a point where they have the capacity to actually deal with the cleaning and, you know, the checking temperatures and making sure PPE is in place. I mean, this is all very, you know, newer kind of environment, and I think it's, you know, with obviously a lot of mosques don't have extra funds, you know, lying around. So even with the lack of funds now, it's going to be putting them in quite a bit of a pressure to you know, kind of execute all the strategy. So I think the more centres come together and we discuss this in a way which will be more cost efficient and more like safe, because for us is the paramount. We should be united and just have one word at the end, one voice when we're all opening. And like I said earlier, it doesn't have to be when the government says we can now move forward, but it has to be when we feel that the community is safe and understands the risks involved.
Yeah, no, definitely. Thank you so much for that. I think there is a lot of considerations for mosques, big and small. Part of that is resource, but also access. And I think if we can share in that network, obviously that will improve things. We need to move to our next guest speakers. Brother Mohammed Ijaz, I have you're going to speak, but at the next slot, inshallah, so I haven't forgotten you. If you could just hold on. Thank you so much. I have a schedule that I need to keep to. So thank you, thank all of you so much for your thoughts and contributions. I'm now going to ask our brothers from the British Islamic Medical Association just to give a little bit of guidance, and then we'll have some more speakers from London mosques.
Assalamu alaikum wa rahmatullahi wa barakatuh. This is Wajid, and I've got Sister Sharifat with me as well. Sister Sharifat, do you want to go ahead first with talking about the second wave? If I could just hand over to you first.
Assalamu alaikum, everyone. And thank you, MCB, for this wonderful episodes. They're quite engaging and informative for our community. For the second wave, as usual, I mean, most people have talked about following the guidelines, but medically, we are looking into people to get screened for the mosques, to screen people as necessary. And we have to follow also the risk assessments, look into the children, the elderly, people that are pregnant, people that have some comorbidities as well. So when we screen as necessary, we look into all those key people within our mosques that we want to consider when we're planning, we're opening. Also, we have to still be alert. We should alert ourselves of the possibility of a second wave. Okay, this is likely that it's going to be, but we're not saying it's going to be now, but we have to be alert that there's a possibility that we're going to have a second wave. We don't know now, but please look out for the signs, read informations. If you need any help, contact MCB or contact BIMA. Then as much as possible, keep following and listening to guidelines. And we have the booklet here, and we can just share this with our mosque community as well. And as much as important, they ask questions and encourage the community in your mosque to ask questions. That's the data I've got here at the moment. But most importantly, please, we want everybody to know that there's a potential possibility of a second wave. Thank you.
Jazakallah khair, and thank you, Sister Sharifat, for that. So, as Sister Sharifat was saying, that we have to be mindful of a second wave. We just want to touch on a very small issue over here, but it's key when people are coming into the mosque, what kind of screening should be done at the entrance. We have to be realistic here. You know, if you ask the healthcare professionals, they'll want to do a full screening and take a full history and so on and so forth. This is not realistic at the mosque entrance because you want to get people in quickly. You don't want a big queue. And also the people who are doing the screening will not always be healthcare professionals, or they're most likely will not be healthcare professionals. So ideally what we want is we want to have a system which is enforceable by anyone, which is easy to do, that does not take a huge amount of time and space and effort. So I'm just sharing here, this is the appendix we have in the document, the guidelines published by MCB, 5 steps for screening. Some mosques will do more, some will do less, but it should be very quick. When we say screening, we're just saying just having a look at the people who are coming in. If someone who's coming in, number one, is obviously high risk, as in they are older, or they look sick or something like that, then you should say, excuse me, just being very polite, like they are at the shops, if they're trying to sell something to someone who's under 18, they ask, what is your age? Then that's one thing that you should screen for. Someone who is obviously high risk, because a lot of people, especially our over 70s, or maybe somebody who's maybe we know that is unwell, may still try it, and we have to be very polite and ask them, please don't pray over here. Let me give you one very quick example. I've had many people contact me. Sister Sharif, if you could just mute yourself, please. I've had many people contact myself, say that I will take the risk for myself. I know I'm 75. I want to take the risk. I want to go to the mosque. And what I tell them is, if you take the risk for yourself, you're also taking it for your wife. Because you will go and get the disease, you'll come home, you will survive. What about your wife? She's 74, she's 73. It's not fair on her. You cannot take the risk for other people. Number two, check that they're covering their face mask or any kind of face cover. Like we said, this is not 100% necessary according to government guidelines, but we know that there is very good evidence wearing a mask is protective, it is helpful. So we would recommend people to either at least cover their face with a scarf. Number three, checking temperature. A lot of people say, why should we check temperature? Because people can have COVID without the temperature. This is very true. And the reason we put it there is not just for a medical reason. As we explained down here, the inclusion of checking temperature is not only for medical reasons, it's to help with queue management. When you have someone standing there with a thermometer, people will stop for the thermometer. They will not stop for you, They say, oh, who's this? Wajid? Who cares about Wajid? I'm walking past. But thermometer, people will stop. So it gives a kind of a virtual barrier. Number four, just ask them, you have your own prayer mat, of course, that's good, and that they have done wudu at home. So these things, hopefully it will only take 30 seconds. Looking at someone, straight away you can tell if they have the prayer mat, if they have their face covered, if they're obviously in a high risk category, and you can do a quick temperature, Jazakallah khairan, go in. So it only should take a few seconds, but it acts as a virtual barrier between the outside and the inside world. I think that's everything from ourselves. Obviously, you have to adapt this to your local area and your local guidelines, inshallah. And if there are any questions, please do get in touch. Jazakallah khairan.
Thank you so much, Wajid. Is there any, I'm just going to have a quick look at the comment section. We have a question. What is the medical advice on the reduction on distancing to 1 meter? And I believe there's another, over 70 should pray at home. Okay, even if they don't have any symptoms. So do you want to just respond to some of those?
So on that point, yes, over 70s, pray at home, even if you don't have symptoms, you are at high risk. Number two, the government is very likely, it's almost certain to reduce to 1 meter. The advantage of this is that instead of having 25% capacity in your mosque, you can have 50%. And it will be very tempting. And we would advise as BIMA, please don't do it. Let me give you one statistic. At 1 meter, your risk of catching COVID is 13 to 15%. At 2 meters, it's less than 3%. Why would you take that risk? They're doing it in the pubs and the restaurants because they will need to earn money. And we are higher risk. We know BME communities are higher risk. We're in the mosque, we're in a closed space, and we're there for not 1 or 2 minutes, we're there for 5-10 minutes. So we cannot say, medically, everyone is over the place. The World Health Organization says 1 meter, but those guys are they're changing their rules as well. You could see that at the beginning of the weekend, they said that there was no COVID spreading from asymptomatic patients. Then they changed it again during the weekend. So in some countries, they go by 1 meter, some by 2 meters. So I can't stand here and tell you, oh, medically, this is the only answer. That's not what we're going to say. We're just giving you the information. At 2 meters, your risk is 13 to 15% of catching it from the person next to you. At 1 meter, at 2 meters, it's less than 3%. At being next to someone who has COVID for, I think it's only a few seconds at 1 meter is the same as being next to them for 20 minutes at 2 meters. So that's the advice. We would advise stick to 2 meters if you can, inshallah.
Just 2 further points. There was a lot of questions regarding shoes, shoe racks and removal of shoes. So what is the general advice around that? And what do you do if someone wants to use the toilets in the mosque? We know, so say someone comes to the mosque, they break the wudu, they need to do wudu again. What's our advice?
The toilet and wudu answer is different. If someone needs to use an emergency toilet, I mean, you should have 1 toilet for use as an emergency, which you don't highlight because everyone will say every use is an emergency. But wudu is not an emergency. They should do the wudu at home. Again, this is just advice. They may have 1 area, but all you need is 1 tap, and the 1 guy who goes and uses it, unless you're going to disinfect after every single individual uses that wudu tap, it makes life very difficult. The shoe rack issue, it's not a medical question. It's a logistical issue, because in some mosques, they have nice big space. So it's not a choke point for the crowd. In other mosques, it's a choke point. What we've seen some mosques suggest, which makes a lot of sense, because they want a one-way system, is they say, don't use a shoe rack, bring your own bag from home, put your shoes in the bag and keep it next to you in prayer. So you put it next to you at that time, and then you can leave by the exit, because if you take your shoe off at the entrance and put it there, you have to come back to the entrance. And this is, again, this makes one-way system complicated. If you keep it with you, you can take it out with you on the exit. But it's not a medical, it's a logistical issue really for the masjids. And apologies about the India-Pakistan thing.
Okay, on that note, thank you so much. We're going to move on, inshallah, to our next group of speakers. If you do have any further points, just put them on the chat and inshallah Brother Wajid will answer. Okay, next I'm going to ask a representative from the UK Islamic Mission Mosque in West London. Do we have someone here? To UK and West London?
Yeah, sorry, I forgot to
yeah, it's always the unmute,
yeah,
isn't it?
yeah. Okay,
sorry.
Yes,
no,
yes.
No
Yeah, it's Abdul Karim Khalil from the UK and West London Islamic Center. First, I want to say thank you to the MCB for organizing this, but also more importantly for all the work that you have been doing since this crisis started. It has been really highly appreciated and greatly helpful. And definitely the latest guidance is extremely helpful. So may Allah bless your efforts for this, inshallah. I don't want to repeat what the other brothers have already said, because we have been discussing this among the group for weeks and weeks now. I just want to maybe highlight 2 issues. One is the, first of all, I mean, ideally, we don't really want to reopen mosques until it is safe to do so without or with minimum restrictions. And the reason for that is it's easy and good to talk about all these restrictions and all these guidelines and so on, but in practice, as we probably all know, it's very difficult to really implement them, and the resources in manpower required is quite substantial. But more importantly, most of the mosques in this country, most of them, are not really geared up for that kind of management anyway. And if the big mosques like the 10 in London reopen, they probably have the resources to manage it. The other mosques, the smaller ones, the ones with less resources, with less capacity, with less facilities, which are not really like converted space and so on, I think they will be under pressure to reopen, and they will be the ones who actually will have probably more difficult times and more risk. So we have to keep in mind that it is for the welfare of the whole community that we need to consider the weakest among us, and we move at their base. We don't just go with the base of the ones or the big mosques. So that's one thing. The second thing is okay, there are things which we can control. We can require people to wear masks, and we can remove masahah from the mosque, and people bring their mats and so on. That's fine. But the other control element which we need to think of is actually, and this is for the medical people to advise us on, is the combination of time and social distancing, which we can manage congregational prayers. From what I understand, gathering for less than 15 minutes is considered safe. Now, presumably, given certain, spacing in between. So if we can, get some advice on the optimum combination of those two, they say, well, look, you can have congregational prayers as long as people are, say, 1 meter, 2 meters apart, and it's the whole thing lasts only for, say, 10, 15, 20 minutes. I think that will be good guidance in practice, so that we can manage these daily prayers. Of course, the Friday remains a big concern for us because of the sheer number of people. And by the look of it, probably it will be very, very difficult to actually implement. You will end up doing maybe, multiple number of prayers, which will be very impractical. And also, managing people going in and going out and so on. So it's, we need to think about that. Yeah. But again, any guidance from the specialists on the optimum combination of time and spacing, so that we can actually manage, congregational prayers, that will be very, very, very helpful. The other thing is it will be very difficult, for example, to coordinate all over the country, but at least regionally, if we can encourage coordination, on like local levels, so that we can help each other. Like I said, there are many small mosques which, they need help. And so we need to actually coordinate, so we work through this together. When it comes to risk assessment and all this, we need to work together and work together. Okay, and hopefully we decide together when to be open and not to rush, even if we need more time, even beyond the government date. For example, if they say, for example, the 4th of July, then we need not to rush and just open on that day. Maybe we need to have allow ourselves time, maybe a few weeks, to coordinate and to bring everybody to the level to be ready, and then we open together. So that sense of cooperation and coordination, that's very, very, very important. Yeah. I think I will stop there, and then maybe
thank you so
in
much.
the discussion I can add if there's any more.
Yeah, there's a couple more mosques, inshallah, that we're gonna get through. I'm gonna ask Brother Muhammad Ijaz, who's been very patiently waiting for his contributions, inshallah, just for a few minutes, and then a few other centers. But I think you're gonna have to unmute, Brother Muhammad.
Is it me? Or
can you?
Oh, okay, Muhammad Ijaz from South London Mosque.
Yeah, can you hear me?
Yeah.
Can you hear me?
Yes, we can hear you. Yeah.
Thank you. First, I'd like to thank MCB for arranging this meeting. And secondly, they have put up the assessment, risk assessment, which I thought was very thoughtfully and very thoroughly put up and given to almost all the masajid. But I think my concern is two. First one, we are not concerned about individual prayers, which everybody can do it at home. We are concerned about the Friday prayers. Now, Friday prayers had two aspects. One is congregational aspect, and the second, which is a prayer one, and the second one is a social one. The first one, I think we may be able to control to some extent, because within 10, 15 minutes, as a lot of brothers mentioned, it will be over. But it is the social event, which means after and before, people do gather together. And no matter what you do, it's very difficult to keep them segregated and separated. They usually come to the mosque on Friday to chat, to talk, and that aspect will be difficult to control. And my concern is that at this moment, very difficult to have that kind of crowd, especially where you have a very small space and more people, like ours, for instance, nearly 1,500 people come. Now, many of them elderly, no matter what you do, you cannot stop them coming. Whatever we say to them, they will refuse. And I think it's a matter of controlling them, and it's not possible. So my suggestion at this moment is we must have to wait a little longer when the dust settles and less cases comes forward, so that we may be able to peacefully do our prayers. At this moment, I think it's rather too early to open up Mosque for the Friday prayers. Now,
thank you, Brother Mohammed. Yeah, thank you so much. We've got a few other people to squeeze in, but I really appreciate the concern and thought, and I'm sure all speakers will come back to this. I think it seems to be an agreed sentiment across the board. I believe we have a representative from the Al Nagashi Center, or is it Najashi Center, just to speak for a few moments.
Assalamu alaikum.
Alaikum assalam, Abu Bakr.
Yes, how are you? Are you okay?
I'm like, good, yeah. You just got a few minutes, so I'm going to ask you to be concise, inshallah.
Yes, absolutely. First of all, Jazakumullah khair for the comments and details, which is actually very refreshing and welcoming. I think my comments are is to do with actually the gradual element of gradual return to life, where individuals will be coming to life, not just to the masjid. So we also need to look at the holistic view of ensuring that when they do return to life, the spiritual aspect has been taken care of by the masjid. So take that into account, and we're doing all that we can. There are an issue here as well, that when we ask the elders and so on not to come in, let's have that balance of understanding that what alternatives are there in place for them, and that's also very important. And finally, I think we have a number of expertise and panels and supporters across the masjid, and I agree with the brother Abdul Karim Khalil on this, that if we support the smaller masajid as well as we progress, this also ensures that we have a holistic approach on actually dealing with common issues, especially when the second wave are actually approaching and coming and so on. So we need to take things balanced. And finally, we don't want to be so rigid that this risk assessment model, it becomes a fixed document. It's actually a fluid document. So we need to understand that this document will alter, changes, and adapt that model of fluidity. That doesn't mean you to be relaxed. It means that you really need to understand you deal with the social element. So Jazakumullah khair for that fantastic work, and may Allah Azza wa Jal make it easy for us all.
Thank you so much, Brother Abu Bakr. Excellent timing as well, so bonus points there. I'm just going to ask a representative from the Mayfair Islamic Center just to speak briefly. Brother Samir.
Assalamu alaikum wa rahmatullah.
Wa alaikum assalam wa rahmatullah.
Thank you very much for this gathering. I really appreciate that, and we really benefited from everyone had a speech about how we're opening, how we are preparing. Many things were mentioned. Alhamdulillah, we were already like doing this in terms of like how people will enter, how people will go out, how people will, if emergency will perform, will do. But one thing I would like to mention just quickly of doesn't matter how big is the mosque is, but the thing is how is the level of attendance of the attendee of the mosque. You know, as we Mayfair, we are in heart of central London. We're not like a huge center, a big mosque, but the level of attendees is very, very big. You know what I mean? So this is what we're working on. I would like to mention that we need to educate people before we just try to open together, which is very good option. But we should just send a message for everyone, for all our communities, that how to prepare themselves as well. As a mosque, yes, we need to work hard to prepare our mosque, and they need to be prepared as well, like in terms of how they will approach the mosque. They need to have their own mat, they need to, all things mentioned already. So this point, I would like to mention that how we need to send the message out through mailing lists, through WhatsApp groups, and any kind of like messages, and educate people who are expecting to come to us, like how you going to approach the mosque in what mentality. Thank you so much for letting me just mention a few things, and thank you for everyone that has a speech. Thank you very much.
Thank you so much, and again, wonderful timing. I think there's a really critical point on what is the user experience going to be, and even as has been said in the chat, many people are doing videos just to work that through. But finally, I'd like to pass it to Brother Mohammed Kuzbar from Finsbury Park Mosque, inshallah.
Assalamu alaikum wa rahmatullah. Can you hear me?
Yeah, we can hear you.
Yes, assalamu alaikum wa rahmatullah, everybody. Jazakumullah khair for this very important webinar. I'm not going to repeat what my colleagues just said. I just want to add some points which probably not been covered, and I think it's quite critical to discuss not just only what we're going to do inside the mosque and preparing all these, which is very important and very vital, but I think we should look as well for other perspective, the wider consequences as well, and the wider view on how we open our mosques. Actually, I'm sure some of these mosques will be in the spotlight in terms of media and the public when we open, and we have to be careful. I know from my experience in Finsbury Park Mosque, I'm sure many of you are aware about our mosque, about the history and how we moved on, but still we are in spotlights. Even during this COVID-19, we've been actually, unfortunately, we've been mentioned many times by far rights like Katie Hopkins and tweeted about false things about the mosque. I think someone should mute. Yeah, we have to be careful about this because some of our mosques will be mentioned in the media and elsewhere about what we are doing inside the mosque and how we're going to deal after we reopen our mosque. So I think this is very important, and we have to prepare ourselves about how we deal with this issue if it happens, and how we can avoid any negative coverage about our mosques and about our community. And from here, it's very important to educate our community, to educate them by explaining to them why we are taking these measures. And this is not an easy task, by the way. It's very difficult, I know that, but we have to start from now educating our community by putting on our websites and social media what we are going to do from now, preparing them from now about the steps and the actions and the measures which we are going to do. And of course, by time we might change these measures according to the government guidance and national organizations like MCB guidance and so on. So, but it's very important we start preparing our community and educating them, and we have to be very wise in dealing with issues happening inside the mosque. I'm sure some of us will face problems by individuals who refuse to follow the rules, for example, or to follow our instruction and so on. How are we going to deal with these matters? We need to start thinking about it from now, because we don't want to end up having the police or having fights inside our mosques and within our communities. So it's very important to start thinking about these issues, because I'm sure we all will experience something like that. The other thing, sharing good examples and best practice between the mosques. And this is, again, is very important, nationally, regionally, and locally. And I just only want to emphasize about the local coordination. Some brothers mention it. Coordination is a huge thing, and it's very, very vital and very important. Coordination, local coordination between mosques. Because if we want to show unity and we want to show leadership and to avoid any confusion among our communities, because if 2-3 mosques are next to each other, and I'm sure every one of the local community go and pray in each of these mosques. If they come to a mosque and they find that they are taking different measures than the others, this will cause huge confusion. And then we will start having problems, and people don't follow the rules because they will say, why you are doing this, the other mosque is not doing it. So it's very important to have this coordination locally between the mosques. For example, our mosques, we have 3 big mosques in Finsbury Park and Islington Roses. We have a piece, for example, for the prayers together, Jama'ah, because in that way we avoid. And during the summer, you know, we can have Jama'ah between Maghrib and Isha, and this will avoid people staying from Maghrib until Isha in the mosque, because it's short time. Then and this give that and have the time to do it, and this any spreading of the virus. So small things like that would help, inshallah ta'ala. Regarding the 1 meter and the 2 meter, which is Dr. Wajid mentioned, I understand his point, but he has to understand as well, the problem is people will question us if we take these measures that the government give us the opportunity to have 1 meter, and we stick with the 2 meters, and people will question that, why you are doing that, why you are not allowing people to come to the mosque. So we need to think as well about the community perspective and community views on this, because I'm sure a lot of people want to come back to the mosque, and if we don't allow as many as we can, taking of course the measures, the proper measures as well, we will be questioned as a committee and as trustees, and we want to avoid that. Finally, I just want to talk about sisters and women, and I'm sure many mosques probably they might take a decision not to allow women to come back to the mosque, because temporarily, of course, because of what's going on, because they don't have enough space now. So my advice that the mosque who used to allow who used to have women prayer hall, they should take the same measures as they are taking it to the men, to take it for the women. If for example the hall take 40 sisters before, now probably they can take only 15. All right, let's take 15 and give these places to spaces to the sisters. We shouldn't take a decision not to let our sisters back to the mosque if we can have these measures and put it in place and allow the sisters to come to the mosque, because again this will be in the spotlight, and believe me, a lot of people are waiting to hear about what we are going to do about this. I can see I've seen some even Facebook pages which been set up to tell sisters who are not allowed to the mosque to report it to these Facebook pages, so they can you know they can campaign or whatever. So we have to be careful. If we can make the same measures to the sisters to allow them to come back to the mosque, let's do that. Of course, we know children are not allowed. That's completely understandable. But for sisters, they are similar to the brothers, and they should be allowed to come to the mosque. So I probably just stop here. Just only one final thing. about risk assessment. I think this webinar and other webinar is a risk assessment. Risk assessment is not about papers and forms which we fill. We can, we can encourage our community, our staff, our trustees to attend such webinar, because this is a risk assessment, and we can put it in our record that we attended these webinars, which we learn a lot. I learned a lot from this webinar and other webinars. I attended many webinars as a listeners and as a speakers, and I think we've learned quite a lot. And this is a risk assessment. It's very important to understand the risk assessment. It's not about form to fill it and that's it. It's about understanding the whole process and what we should do and what we shouldn't do. Finally, again, about staff and volunteers, it is quite crucial to start preparing the volunteers and to be all on the same page. Volunteers, staff, trustees, because we don't want to confuse again our congregation when they come, when they ask one volunteer something and another staff or another trustee gives something else. So we don't want to confuse our congregation. Let's have a big meeting for all of them and try to explain to them what we are doing and make sure that they understand it all fully and all understand it in the same way, so they can give the same advice and the same answers if they've been asked. I'll stop here. Jazakumullah khair. Assalamu alaikum.
MashaAllah, really, really brilliant points, I think, from Brother Muhammad Kuzbar, and definitely a good 360-degree look at the risk assessment is not just a piece of paper to fill in, and also acknowledging that it'll be important to consider the sisters in definitely this reopening phase. I've been asked just for a few other contributions. Is Masjid at-Tawheed here?
So what's the question?
No, it's just whether you wanted to speak to share some thoughts from Masjid at-Tawheed. I've just been asked that there's a couple of people who wanted to contribute.
I'm not Masjid at-Tawheed. I think it's someone else.
Oh, okay.
We're from Darul Ummah. We're from Darul Ummah, yeah. Darul Ummah.
Darul Ummah. Yeah, Brother Qazi, would you like to speak and share a few of your own thoughts?
Yeah, sure. I think most of the topics have been covered, and it's nice to see. Obviously, thank you to MCB and to everyone that's organising it. I think one of the things that the brother from Bima mentioned about using so much for queue management, at least I really like that, and I've noted it down as well. Apart from that, I think it's really about understanding and communicating, as we've all said, with our crowds and with our congregations, especially with the elderly. And it's really, really important to take into consideration the kind of emotions that our community has been through over the past several months. And so, alhamdulillah, I think it's everyone's aware of this. But again, Jazakallah, I wasn't really expecting it. So, but anyway, I think most of us are making the preparations, and Darul Ummah, alhamdulillah, we've made our risk assessments and contingency plans, and also are communicating. I think it will be very beneficial for each masjid to have their main point of contact, like the imam or someone, to make a short video to be sent and shared to their respective communities about what to expect when they come back to the masjid. I think that will be something that I think will be very beneficial, because people like to see it from the imam or hear from the imam. That helps a lot. Yeah, that's about it. Thank you.
No, thank you so much. I appreciate it. It was a bit unexpected. I think Brother Jamal Turk also had some points to share as well.
Bismillah ar-Rahman ar-Rahim. Thank you very much for giving me. I've listened and I have read most of the comments. I have very, very practical solution to almost all of these issues. All of these problems can be solved in few words, and I'll come to the solution, but let me give you the introduction. Now we spoke about one-way system, entrance, exit, about handling of shoes, about emergency toilet, about so many things. All of these things can be solved by the solution that I'm proposing in a minute. Now we know that this problem will not be eradicated in a few weeks or a few months. Reports are speaking about a problem that will stay for maybe a year, a couple of years, maybe more. So we have to be prepared for this worst scenario. The suggestion that I have in mind that it relies on the very basic of the definition of a mosque. Our mosque, what is the mosque? If we define the mosque is the premises, is the building, this is the problem that we are in the middle of all of these associated problems that we are faced with. What is the definition of a mosque? Rasulullah sallallahu alayhi wa sallam said, وَجُعِلَتْ لِيَ الْأَرْضُ مَسْجِدًا وَطَهُورًا. All the earth or the ground is a masjid. There is a specific characteristics for Islam, for Muslims. They can pray in any place, in any ground. This is characteristics that is not found in any other religion. This is the first point. The second point, and I'll come to the first point. The second point, that vast majority of Muslims, they feel guilty for missing Salat al-Jum'ah. I know because of the nature of my previous work that Jum'ah prayer attract tenfold the number of people who come to the mosque on Dhuhr, Asr, Maghrib, Isha, and Fajr. 90% of the Muslim community, they are not, they don't feel guilty about missing Salat al-Dhuhr in the mosque, but they feel guilty about missing Salat al-Jum'ah. So the definition of the mosque, if we define the mosque is the whole ground, so we'll come to this suggestion. Muslim MCB, if we can get permission from the local councils to use the parks, the stadium, the opening grounds, the beaches, to get access to do Salatul Jum'ah in these open fields. If we can get this, even if it is in pioneering level, let us
Brother Jamal,
in a few places and see how it will work. If it works and properly, we can expand it. We can double. We can do more examples. Hire or ask for permission to use park, and we'll keep social distancing. People will come with their prayer mat. They'll come with wudu. We can control the entrance and the exit place.
I'm so sorry, Brother Jamal. It's just we've only got a few minutes left, and there's a couple of questions.
Yeah,
but thank you so much. Feel free to continue in the comment section. And I think there has been a lot of calls for considering open Jamaat, especially seeing the IKEA Germany example. So definitely a really important point. And if I could just go back to Brother Mohammed Kuzbar and some of our other panelists, there's been a couple of questions coming in. One question, are we overthinking this? If people can go to supermarkets, shopping centres, and the government can trust them to be generally safe, what is the minimum viable solution to reopen?
Well, mosques are different than supermarkets, and we know that. Supermarkets, they are taking their own measures, and we should look at our own measures in the mosque, which is quite different. We are talking here about people coming to worship and to pray next to each other, and many of them, they know each other. They usually, as some brothers said, the mosque is not just only about worshiping, it's about socializing as well. And this is another issue which we have to deal with it, how we can make sure that people come to the mosque and stop talking to each other, hugging each other, shaking hands and so on. So we have to start a new era in terms of how we deal with these issues inside the mosque. So the measures is different, of course, and again, if anything happened in the supermarkets, nobody will blame the supermarkets for they will blame the people who did it. But if something happened in the mosque, we as trustees or as management or whatever, we will be blamed for it. So this is why it is very, very important for us to take the right measures and make sure we minimize any risk of having any issues, inshallah ta'ala, in the future.
Yeah, just a couple of points on, is there any point opening if we can't do Jamaats? And I think also around the type of security, or I guess managing that whole process of people coming in and queuing in, and do we need security, or how are we best prepared for that?
Yeah, no point of opening the mosque if we don't have Jama'ah, because the main practice in the mosque is the Jama'ah, the congregational prayer. So this is why most of the mosques, or I think all mosques throughout the country, they are not opening for individual prayers. I believe many of them, they are waiting for the 4th of July to open, which is the right decision to take. In terms of what is the next question? What is it?
I guess kind of the best practice in terms of people are going to be coming to the mosque, and
Right,
I guess
yeah.
it was touched on, yeah.
Well, it's different from mosque to others. Some mosques are small, some mosques are in the main road, and they don't have even a pavement to queue, and this is an issue which they have to think about it very carefully. Some mosques like ours, we are not in the on main roads, and we have a very large pavement where people can queue, taking into consideration, of course, the 2 meters or 1 meter spaces. So we need to think about as well, if sisters coming to the mosque, how they're gonna queue, how the brothers gonna queue. During Jum'ah prayers, most of the mosques are thinking to have 2 Jum'ahs. How they're gonna manage that? What is the time which they allow for people to leave the mosque for the first Jum'ah prayer, and then for others to come back? Some people, they don't have even fire exits. They have in the same one just entrance. How they're going to deal with these issues? So it depends about the size of the mosque and the location of the mosque as well.
Yeah, that's great. Is there any final comments from anybody? Abdul Karim? I think we're going to wrap up otherwise, inshallah. I know there's been a couple of points on opening of madrasas. Obviously that is going to be subject to government guidance as well, but I guess in the meantime, our advice would be to continue with classes online.
Yeah, just on this, Sister Zara, only I think mosque should open for prayer now. They shouldn't open for anything else. Meeting circles, youth clubs, conferences, and so on. This has to stop completely. Only we are allowing brothers and sisters to come to pray, and not to as well for the whole day, just to pray for certain time, to come like 15 minutes before prayer and 15 minutes after, and after that the mosque should be closed. So this is very important for all mosques to understand. Otherwise we will start having problems, and the risk will be very high if we allowed for anything else.
Yeah, no, thank you so much. And unless there was any other thoughts, Abdul Karim?
Yes, well, was just to say, well, thank you again for all the contributions. I think in conclusion, as it was obvious from today's exchanges, that the more we talk about this, the more we think about how complicated it is that we realize. So I think our mindset should really be not to reopen until it is really safe, with minimum restrictions. We should remember that, especially when it comes to mosques and prayers, that tuma'nina, tranquility, is actually one of the essentials of actually performing the prayer. And if you don't feel actually safe, and you feel concerned about who is next to you, and who's coughing and who's this, then actually you don't have. So I think we have to be. I think there's a strong Sharia case here, not to rush into reopening. People can pray at home and can wait a little bit longer until it becomes really, really safe. So that's one thing. The second thing, it is obviously very, very important that we need to make sure we coordinate, that ideally not to take any action except collective action, because that otherwise will be counterproductive if some of us open and some of us do not open. So I think we need to spread this, and I talk about it with other colleagues, other mosques, that we need to coordinate and work in this together. And I am sure the MCB will play a central role in this, because they have this overall view across the country. So please try to push for this message across, inshallah.
Definitely. Thank you so much, Brother Abdul Karim, and to all of our guests and contributions as well on the chat. If I can now just bring up Brother Hassan Judy just for closing remarks.
Thank you very much, Sarah, and thank you to all our panelists for sharing their contributions over the last 90 minutes. Just sharing my screen. Much food for thought, I'm sure, and I've certainly learnt and picked up some important points today that I wasn't aware of from before. So really useful to hear and just to get a feel really for what different people are thinking, saying, doing, and as I think the feeling in the room here has been about, focusing on that 4th of July, if not later date, and also on that key message, do not rush, which is what MCB has said earlier this week when we put out our guidance. Yes, the guidance is there. Yes, it will be permitted. But as has been emphasized by some of the speakers as well, that doesn't mean that we need to rush and to do things not to our fullest abilities. Just to wrap up on a few points and answer perhaps some questions that people may have about next steps. Wanting to reiterate about classes and madrasas and etc. Certainly reiterating the point that was made that where we can do it online, they should continue to be done online. And most people who I'm speaking to across the country, madrasas will most likely remain online, at least until the summer, if not September. Even if the government does allow it, a lot of people are, and that's what they're telling me. Second, with regards to the point about outdoor and the usage of outdoor space, definitely we saw in other countries abroad that being used, and definitely, case in point, and then this was mentioned at one of the sessions last week, at the moment, up to 6 people in England from different households can meet together and can potentially, pray Jumu'ah together if they wanted to, with 2 meters apart in someone's back garden, in a park. And so, again, as part of that, educating our communities that, yes, the masjid may be open soon, inshallah, but with heavy restrictions, we need to also educate them that, it's a new, not quite a new normal, but a new reality. And maybe it is a case that we encourage our communities to say, okay, well, you can't come to Jumu'ah every week because of the limited capacity, but can we help our communities to organize themselves, and they can pray in small groups of 6, for example, in private gardens or elsewhere. And of course, when it comes to bigger events, more organized events, especially when the Eid al-Adha is going to start to be, people are going to be thinking about that very soon. Clearly, with the current restrictions, not possible to do any kind of Eid in the park. But if things change, people will be asking questions about that as well. And those who are involved in organizing large-scale events in open spaces will have some considerations to think about as well. And to reiterate the point that Brother Muhammad Kosbar also made with regards to female prayer spaces, the women's prayer area cannot be emphasized enough. That where your masjid already had facilities before, it is really important that you maintain that. I've heard it from many people, both male and female brothers and sisters, that women have also faced the brunt of this lockdown in the last few months, just as much as men, if not more. And so it's very important that when it is safe for masjids to reopen, that women do not face an additional barrier by being blocked out from our masjids, and they can also perform their prayers and connect with their creator, Allah subhanahu wa ta'ala, in the house of Allah in the same way that men can. Unfortunately, we are seeing some cases, mainly in the north of England and in others, where some masjids are saying that masjids they're going to reopen, but the sister space will be closed. And this is very sad, unfortunately, and it's important that we emphasize to our communities that this is not a good place to be in, and that the women's prayer spaces are open as well. With regards to next steps, so of course things have been changing rapidly over the last couple of weeks, and they will probably continue to change depending on different decisions and who the government is consulting and what decisions they make, etc. With regards to reopening, and of course based on the latest medical and scientific advice as well. I think that from the MCB's point of view, starting from next week, we are planning a series of training webinars to be announced soon, inshallah, on a variety of topics. centered around reopening from the medical point of view, from the legal responsibilities point of view, and also fundraising, not a topic that we discussed or touched on much today, but of course the financial and the funding aspect of our messages during lockdown and beyond is also critically important as well. And there are mechanisms and supports and campaigns available out there, such as the Support Our Mosques campaign that MCB has been supporting, and others that can help messages in that regard. So do look out for that to be announced very soon. If you aren't already receiving MCB email updates or on the WhatsApp, Telegram announcement groups, then the links will be sent to you afterwards, and feel free to join those to keep updated. And your feedback on today, on anything else that you're hearing with regards to reopening, with regards to risk assessments, with regards to training, support and others is most welcome. Please get in touch by reply or email us on covid@mcb.org.uk, inshallah. With regards to, again, our apologies that today is slightly overran, but hopefully it was a useful session. This will be it has been recorded and will be uploaded onto YouTube as well. So if you know anyone who wanted to attend today but wasn't able to, then you can direct them to that link where they can watch it on YouTube as well. And Jazakallah once again to all our speakers from the London Masjids for joining us, for sharing what they're doing. May Allah subhanahu wa ta'ala keep us safe, keep us protected, keep us always striving to work and to spend from our time and from our efforts for His pleasure and His pleasure alone, inshallah. And we look forward to welcoming you on a webinar again very soon, inshallah. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Yeah, thank you so much, Hassan. Really important closing remarks. And again, thank you to everybody who's contributed. It's been a really great discussion, really critical points, and we hope that you'll continue to develop how to reopen safely, and obviously MCB is going to be here to continue to support that journey as well. I think there's a fantastic resource right here in all of us sharing. And again, thank you everybody for your contributions. I'll accept, inshallah, Ameen, and make this a safe and smooth process for us all. Ameen. Okay, take care everyone, and enjoy the rest of your Sunday. Assalamu alaikum wa rahmatullahi wa barakatuh.